everyone who's logged in, dear delegates, honorable guests, ladies and gentlemen. We are delighted to come live from the Africa Healthcare Federation across the continent with over 30 country leadership being invited. I can see that we now have over 59 leaders that have logged in, and these are leadership from the private health sector that are keen on engaging the public sector on leveraging partnerships, on how government and private sector can work hand in hand to have a better impact on combating the COVID-19. Dear delegates, we have a very high level and a powerful panel this morning, and I would like to in turn welcome each one of our guests who you can see, and they will greet you. Let me begin by welcoming Her Excellency Amira el Fadil, the Commissioner of Social Affairs of the Africa Union Commission. Dr. Amira, we are very delighted to have you this morning. And please do tell the listeners where you're logging in from.
From Addis Ababa. Welcome, Dr. Thakker.
Thank you so much, Honorable Amira.
African Union, I'm still at home, Dr. Thakker. I'm still at home.
So you can...
I'm taking the call from my house, but I will, after this meeting, I will be in office, inshallah. Thank you.
So that shows you the commitment of all the leaders logging in even early from home, and work carries on. I will now move on to the Minister for Health, Ethiopia, Dr. Lia Tadesse. Dr. Lia, welcome this morning, and please tell the delegates where you are located right now and where you're logging from, and you can greet them.
Good morning, everyone. It's a pleasure to join this panel. Thank you, Dr. Amit. I'm in Addis and actually currently logged in from home.
Thank you, Dr. Lia. Thank you so much. We also have Dr. Mercy Mwangangi, who is the Chief Administrative Secretary from the Ministry of Health, Kenya, where I am also located. Dr. Mercy Mwangangi, can you hear us? Please greet,
yes, I can.
greet the delegates. Morning. Tell us where you're from.
Good morning, Amit, and good morning to all delegates. My name is Dr. Mwangangi, and I'm logging in from winter in Nairobi.
I was just about to say the same, and I was asking Honorable Amira and Dr. Lia, do they feel the winter like we feel in Nairobi? And you can see how Mercy and I are also dressed to make sure that we deal with the cold. Together with the honorable delegates and the speakers, we also have a team that's backing us up here behind the scenes. I'll also like to invite Farah to inform our Francophone delegates on exactly how they will manage the interpretation. We have an interpreter who will do a simultaneous interpretation with an interpreter tab located at the bottom. So Farah, please explain how this works so the Francophone team members who might be on the English side are able to switch on the right tab.
Bonjour et bienvenue à tout le monde et à tous nos délégués. La session, comme on vous l'a dit, sera traduite simultanément. La façon dont vous faites ça, en fait, si vous regardez en bas à droite, vous avez un petit bouton qui est écrit traduction ou interprétation. Si vous cliquez dessus, vous allez voir un petit drapeau français. Si vous appuyez sur le drapeau français, nous avons avec nous Jean-Hervé. Merci Jean-Hervé. Qui va en fait traduire la session aujourd'hui. Donc, appuyez sur le petit bouton avec le drapeau français. Si vous avez des questions, vous pouvez les taper sur le chat box et ensuite, je vais les traduire pour qu'on puisse les poser à la fin de la session. Merci. Thank you, Amit. I just told them about the chat and the questions.
Thank you, Farah. We have a very tight agenda, and I want to move straight into it. I will start with an introduction about the private sector and setting the stage. We have almost about 230 registered delegates. And then we will move on to the Ministries of Health, where Kenya and Ethiopia will share experiences. I'll ask Dr. Mercy to go first with about 3 or 4 questions that are listed here. She will share examples from Kenya during the COVID-19 engagement on structure and action, and then some challenges before she can talk about how private sector can play a more active role. And then they will both, Dr. Lia and Dr. Mercy, will respond to the 4 asks that we have collected from the private sector leaders that I will present. After Dr. Mercy and Dr. Lia present the ministry overview, Dr. Amira will respond to their presentations and also comment on the continental strategy and how Africa Union can operationalize these potential opportunities. Let me then quickly go to what the private sector have been talking about and have been expressing when they're talking about engagement with the government on how leveraging on partnerships with the government and private sector can work. Our history as Africa Healthcare Federation dates back about 15 years ago when countries started forming themselves. It was not until 2016 when we had Mustafa Siddiqui Kaloko, the Commissioner of Africa Union, who thought it was a good idea with 16 countries that came together. And just 2 years ago, when Honorable Amira was in Johannesburg, we had 30 countries that had created themselves into a federation and agreed to work hand in hand through the communique that you see that was signed in October 2018. The 30 countries that you see are spread across the 5 regions, and each of these countries have an organized electorate system that votes in the chairperson, the vice chairperson, and the board members per country. Each one of these countries are then organized onto regions, as you see. The East Africa and the West Africa regions are the most matured when it comes to the private healthcare associations, and soon Southern, Central, and Northern will be initiated, especially in countries where we don't have these federations. When we talk about the private sector, we are all aware that it includes all these subsets of healthcare players, formal providers, technology, health financing. In some countries, some of our presence of facilities is larger than other countries. And in some countries we have manufacturing and in some we don't. But in essence, private sector is very diverse. It includes all these, and we often call them the non-state actors. Sometimes we mistake commercial private sector and non-commercial, or for-profit and not-for-profit, but in essence, it's all the non-state actors together that are part and parcel of the federation. The private sector role in the health system strengthening is very important. I'm sure you've read lots of documents and seen lots of studies about the importance and the growth of the private sector. Over the last 3 years, our private sector growth in Africa has been increasing by 17% year on year, and our contribution both to GDP and also to creation of jobs has been massive. Though we are at 2.2% average as GDP contribution to the African economy, our impact on employment is extremely high. You can see from these statistics that half of the healthcare is delivered in sub-Saharan Africa by the private sector. Not only do we deliver services, but also on products and medical equipment, we are a key and a dominant player. Majority of the manufacturing factories are owned and managed by the private sector. We employ a significant workforce, especially in pharmaceuticals and pharmacy. In some countries, up to 80% of the skilled workforce in pharmacy work in the private sector. These are some of the documents that you know have quoted these statistics. 80% of the private sector contribution is concentrated in 3 areas we have noticed since March, when we have recognized the COVID-19 outbreak in Africa. We know that in February in Egypt, we noticed the first case, and many of our private sector members logged in today started engaging partners and governments. In terms of supplies, we've seen our members get involved in providing testing, supplying all the kits, extraction kits, including swabs. Many of our members have started manufacturing PPEs and then bringing in ventilators and innovations around respiratory systems. We know that mobile tents, field hospitals, and in partnership with the infrastructure experts, we have looked at innovations around how the admissions can take place. But we've also seen a lot of CSR activities where communities are getting involved in food support programs, hand washing, sanitization, awareness, and media. Recently, over the last 1 month, I would say that the resource mobilization has taken a center stage, both in cash and kind contributions. We have seen the efforts by the Africa COVID-19 Response Fund, led by the AU. We will hear more about it from Her Excellency Amira el Fadil. And we've also seen how COVID-19 Emergency Response Fund in Kenya has received tremendous support from companies and organizations listed on the stock exchange like Safaricom and others. And Dr. Mercy might speak to that. But we see that there is a gap, and as the surge comes into our countries, we believe that partnerships in treatment, testing, tracing, and ICT can make a huge impact in saving more lives across the continent. Let me talk about the 7 stages in which COVID-19 mitigation can work very effectively with the private sector. If you look at this chart, it shows you area 1, 2, 3, area 4, 5, 6, and 7. The green boxes show the impact of the private sector, and the blue boxes show the partnership with the public sector. We know that in planning, everything takes place. If you plan to include the private sector more strongly on the task force and more effectively, a lot more private sector impact can be seen, and a lot more private sector organizations will come forward. On screening and diagnosis, you have seen we can do a lot more in sample collection, transport, and mobile labs. In terms of social safety net, area 3, we have been involved in quarantine support, in isolation, offering our shelters for the homeless, and also pushing for community mobilization and behavior change. Area 4 is about ICT, and we can leverage whatever infrastructure we've set up to date. Area 5 is on supplies, whether it is biotech firms or manufacturers of PPE. With the interruption in global supply chain, local manufacturers producing PPEs can be extremely useful and also more cost effective. And area 6 will be around treating COVID-19 patients. As the public facilities start overflowing and you see that the numbers are getting larger, a contracting system on treating COVID-19 patients through the private sector might be very effective to engage in advance to keep the bills down and improve affordability. And finally, of course, mobilizing resources so that we can add into the basket where development partners and other well-wishers are funding in the national kitty. The 4 asks before I now turn it over to Dr. Lia to respond. Actually, I will start with Dr. Mercy Mwangangi, as I mentioned earlier. Our genuine engagement with the private health sector based on trust, honesty, and transparency is an ask from the private sector, And many of the private sector members who have logged in this morning's call, we have about 89 or 90 of them from about 30 countries, do find it difficult to work with the Ministry of Health at times. They feel they're not invited or they are like an afterthought. So a genuine engagement with our sector leaders could help. A core development of COVID-19 agenda and activities like having a task force that invites them. And third is, of course, transparency and accountability in funds and donations allocated to COVID-19. Of concern of many of the taxpayers who've logged in and individuals is to ensure that as money comes in, and if we take loans, how best do we ensure that every dollar is accounted for and every kit that comes into the country is also accounted for. I hope that the Ministry of Health is the champion and takes the lead. And finally, economic transformation, because we cannot be in lockdown forever, and the economy needs to kick back in where the jobs need, people need to go back to work. How do we balance between lives and livelihood? This was just an overview of where I believe the private sector views are. So with that, I'm really delighted to invite Dr. Mercy Mwangangi, who's been a champion in the Ministry of Health of Kenya. Dr. Mercy, you have taken the lead from the front. You've seen what the private sector of Africa have mentioned. Please, we invite you here to address us.
Thank you, Dr. Amit, and thank you to my fellow panelists for joining me here today. Especially honored to be here with Dr. Lia and Madam Amira, who I met in Kenya right before our first case of COVID. Madam Amira had come in on a different issue on our President's Alma leadership. So thank you, and it's good to see you here. In Kenya, it becomes useful perhaps to paint a picture of how we've organized our COVID response before we get into examples of engagement. Through a presidential directive, a task force was put in place, and this task force is known as the National Emergency Response Task Force on COVID. And it's a multi-sectoral task force that has participation of different cabinet secretaries or ministers from different line ministries. In particular, of course, would be IT, defense and transport, sectors that are really on the front line when it comes to the response of COVID-19. And of course, it also has the participation of various agencies within government, and it also has engagement of different state actors. Now, this task force is championed with providing oversight, and final decision-making when it comes to the response measures. And it's supported by a technical task force. This is the COVID-19 technical task force. And in this task force, we split our work into 5 main thematic areas. Area number 1 deals, of course, with labs and diagnostics, which are essential in the COVID-19 response. Area number 2 deals with capacity building, in particular for our health workers, but also for our frontline workers. This includes security personnel, it includes prison personnel, and all other personnel who are really, assisting us in this. And most recently, we've developed a capacity building arm for the youth, just because they're also really championing when it comes to part of the COVID-19 response. We also have a section that deals with communication, particularly risk communication. And this is a diverse group that has a lot of engagement from both state and non-state actors. And perhaps one of the thematic areas that has involved great participation of the private sector. And one may even say has been led by the private sector. We then, of course, have an arm that deals with community engagement. It's become very important in Kenya to ensure that the community are on the front line in terms of our COVID-19 response. And so we have an arm that engages all the different community health volunteers and units that we have in place and deploys them to different areas of action. And then, of course, we have the pivotal case management team. And this is a team that has been working to put together different guidelines and protocols to ensure we have a systematic and structured way in how we're rolling out our COVID response. This is a team that is able to, on day by day, plug into Africa CDC guidelines, plug into WHO guidelines, CDC guidelines, to ensure that there's cohesion in terms of how we are rolling out our COVID-19 response. And so there are other many structures that have morphed in and have come through these two main task forces, the oversight one and the technical task force. And so primarily how we have engaged the private sector in Kenya one is through their participation in the technical task force. And it's been a very interesting experience because for us, participation has involved, beyond mere presence in a task force meeting, we have very many non-state actors actually taking lead in different areas of intervention when it comes to COVID-19. And then of course, one of the most useful collaborations that we've had is with regard to health financing. Kenya was able to put together what we were calling a COVID-19 fund. And this is one fund of a kind in the country because it looks at putting together government and private sector resources. And in this fund, we've had the participation of many, key private sector organizations in the country. Dr. Amit was able to mention some of them. We have Safaricom, we have Equity, we have various banks putting in money and almost, forming a co-financing fund with government and ensuring that this fund is flexible enough to meet some of the extra demands that have come about due to COVID-19. Now, in terms of the granular examples, and I think this is where perhaps the beauty of partnerships and collaboration is best exemplified. When it comes to testing, as you all know, in the beginning of COVID-19 response, most countries in sub-Saharan Africa were struggling with testing. And so I think, in fact, in the first instance, we were flying out our tests to South Africa. And I do remember us getting into engagements with some of the private laboratories within the country and trying to see how we'd be able to, one, share the human resource, be able to, stretch out, that critical human lab resource, and two, to be able to see how we could put in place mechanisms where we could have, one, some form of counter testing with our private labs that are in the country. And this relationship really has morphed on to the point where we've actually had nomination of lab technicians from the private sector joining in our emergency operations center. Our emergency operations center, we say always, is the heartbeat of our COVID-19 response. And it would be interesting if one of you could take a walk in there. You would be a bit surprised because we have close to about maybe 14, 15 organizations represented, all sitting in a big, command control emergency operations center. And so that was quite interesting to see that members from the private sector were willing, really almost on a pro bono basis, to volunteer their human resources onto a government emergency operations center. And in that center, they were able to work hand in hand. They were able to relook at our testing strategy. They were able to deploy a more nimble approach in ensuring that we're able to rationally use the tests that we had and deploy them appropriately. A second example, of course, then would be within our task force, and particularly within case management. I'm privileged and honored to have engaged with some of the premier hospitals in the country, even with, definition of how we'd be able to relook at our patient flows. Kenya is quite vast. It has about 13,000 health facilities. And so it became quite important to be able to communicate to all these health providers who are a mix of private and public providers in healthcare, to be able to define for them, how do you ready your hospital when it comes to COVID-19? What is the appropriate triage mechanism? And so the Ministry of Health was able to benefit from one of our big hospitals in the country, which is a private hospital, and it invited us in, and we were able to go through different processes of triage. And these processes were then incorporated into our case management protocols and guidelines for utilization across the country. And this was also a very good initiative and collaboration with the private sector. And just to Amit's point, it's important to note again, the diversity of private sector in the country. Beyond, service delivery and provision, again, in Kenya, we have a very thriving private sector. And perhaps one of the most, should I say, fundamental lessons in COVID-19 has been that of self-reliance in a country. And so what happened is our private sector industry players were able to kick up and jump into the manufacturing of PPEs and jumping into the manufacturing of essential commodities and products that we required. And this, has seen, great improvements in capacities, not only for PPEs, but also for issues or, materials, that were normally not really, on the front line for us. For example, viral transport media is now being made, and there are collaborations with some private lab research organizations. Currently, right now in Kenya, we are working with different players, in terms of scaling up our capacities. I do remember there was a time when we had shortage of testing kits, and some of these private sector laboratories and research organizations were able to step in and were willing, to share out their commodities, and some of these are, normative research commodities. And that has been a very fruitful engagement and continues on now into looking at different elements of COVID-19, including a seroprevalence survey that is underway. And so we've had really good collaborations there. And then, of course, when it comes to communications, one of the most successful elements in our COVID-19 response has been an interaction with government and state and non-state actors through what we call the Nairobi Business Compact against coronavirus. So this essentially was a coming together of industry players who are mainly associated with water and sanitation. And we were able to put together close to 15 companies who manufacture soap and who are involved, in tank production, who are involved in distribution. And these companies were able to, one, put together, an enormous budget for communication, for risk communication. And so most of the advertisements and most of the, telemessages that we've been putting on through have actually been through private sector collaboration through the Nairobi Business Compact. And one of the most, instrumental elements was that this team has been able to put around 1,000 hand washing stations in poor settlement areas, in the slum areas. And as we all know, of course, one of the key response measures for COVID-19 is the utilization of hand washing, hand hygiene, and of course, physical distancing. And this collaboration continues on, and I'm happy to say that, the Nairobi Business Compact has now morphed into agriculture and food security, which we all know is quite critical. And I can see, one of the fourth asks was on having a balance between having a COVID-19 response and being realistic when it comes to livelihoods. And so what we've done is part of the support and the phase in which we are in right now in the country is really, navigating to have this fine balance and to ensure that we're actually able to support people who have lost their livelihoods and, supporting them, one, in the COVID-19 response, but also supporting them in ensuring that there is, that food secure and that they're safe and that they're able to continue on as we try and combat, this COVID-19, tragedy. So again, lots of really tangible examples where we've been able to collaborate. I particularly remember for the first time I had my architecture class 101 as an architect, again through collaboration with Kenya Association of Architects, and they came in and they were able to take us through different nimble responses as to how health infrastructure can better respond to COVID-19. What are the things and the changes that you need to make in a health facility? What is the most practical way of putting up a field hospital should you need one? What is the most practicable way of putting in place isolation, rooms and centers, and ensuring that you're meeting all the requirements of such centers? And so it was fantastic. It was really, one of the least expected collaborations, that you would have architects and doctors and, policymakers in the same room trying to deal with some of the needed solutions for COVID-19. And again, another useful example of collaboration there. We've also had good engagements, perhaps in the health financing sphere with different private sector players. We've had engagements with private medical insurance bodies within the country, trying to navigate and understand, how would we be able to run through COVID-19 responses, and how would we be able to have proper reimbursement systems and mechanisms that sort of meet the peculiar challenges that we face ourselves in right now. And so really, I would say in Kenya, the private sector collaboration has been pivotal, if not crucial, to our COVID-19 response. And I hear a lot of, the big asks, and yes, there've been a few challenges here and there as we've set up the structure. It's interesting to note, I do remember the first night our case was announced, we barely slept, and the next day, it was really unfamiliar, a lot of dynamic, a lot of changes coming in, and the need to literally make decisions immediately and move on. But I think as we evolved into the response, some structure has come into play, and we're able to respond better. Perhaps I'd say the biggest challenge would be the vastness of our country and should I say the heterogeneous nature, one, of our health facilities, two, of our population. And that has been quite a challenge in being able to, deploy a response. You have to take into considerations different counties, different cultural practices, and different dynamics, and of course the resourcing of the COVID-19 response in of itself. However, again, like any storm, you do weather the storm, and you do evolve, and you do become more nimble in your response, and that's what we've been able to do. I do feel one of the biggest challenges, again, has been to define that fine balance, and I think perhaps Kenya would be an interesting case study as to how you can put in place measures of containment, however, allow some sort of continuity in terms of economic continuity within the country. And we continue then to, of course, study our measures to ensure that they're responsive in meeting the primary objective, which is protecting lives. And then, of course, ensuring that there is also continuity in the economy. I do feel that with regards to what more we can do, and I'm of course being very biased to our own country experience, would be perhaps to have more conversations and more active engagement when it comes to what post-COVID-19 recovery will do. And I think it becomes important always in every crisis to sort of have a team that is, immersed deep into the crisis and that is actively responding to it. But you also need to have a team that's looking at it, 10 steps ahead, and what is it going to look like when, the ash is down and, the dust is settling in. And I think this has been an area where perhaps we could put a bit more effort into and have private sector participation. We do have different committees out of the NERC committee that are looking at post-COVID-19 economic recovery. And so my own ask would be to, essentially have more active participation in this committee, and particularly not just for the health providers in the private sector, but for the whole scheme and for the whole continuum. We want to have those discussions with industry players when it comes to insurance. How are we going to move forward? What will we do if we have a second phase of COVID-19 or any other public health security threat? Are our insurance regulations practicable when it comes to such situations? We need to have conversations about how do we jointly leverage on this new wave of self-reliance and self-determination? How do we ensure that even as we go forward to manufacture PPEs, that the scope of these items is expanded, but also that costs are contained and that the quality is at par with with the needed quality of these items. And so these are conversations, that need to be had. Conversations on how we create contingencies for our country. How do we have, contingencies, for businesses, particularly, yes, in the health sector, and how do these contingencies then translate into public health emergency response funds? So all these are discussions that need to be held, in terms, again, of continuity of essential medical services. How do we protect a bruised economy and a bruised populace who we know will struggle in terms of seeking health right now because they're faced with constraints when it comes to their finances. So how does the private sector come in with the public sector to define a new frame of providing healthcare to a population that is traumatized and bruised? So these are some of the things that we need to discuss. Some of the things that we need to see. What are the biggest, most pivotal lessons that we've learned, and how do we work together in terms of ensuring that there's mandate for this? And I guess most importantly for Kenya, as I wind down to the fourth question, would be how do we ensure that our UHC journey continues? As you're all aware, the president really does hold to his heart the UHC agenda as one of his big four agendas. And so having ensured all the shocks and having gone through all the shocks that we've gone through economically and in the health sector, how do we elevate that UHC conversation? How does it continue? And how do we perhaps also, redefine it in a way that it's sustainable and that it takes into account perhaps the most truest reality that public health security is quite vital when it comes to healthcare. And so for us, what we would say in Kenya is that the 4 asks are not unrealistic. They are achievable. The first ask when it comes to genuine engagement, I feel is one, perhaps if I was to write a book about my experience in COVID-19 would be, on the beauty of engagement. And I've often said this to Dr. Amit, that collaboration is a new innovation.
Yes.
It becomes crucial really to have those genuine engagements, and to have those engagements therefore then, reflected in structure and in planning. And I think this is something that we'd be able to take forward. And there've been beautiful examples of that in Kenya through the COVID-19 fund that actually has a chairmanship and secretarial management by the private sector. And again, also within our response task forces, I think that has been clear. And when it comes to co-development, again, like I mentioned, I would say our case management team, again, highly private sector driven, has leveraged on that contribution and engagement from the private sector. Accountability and transparency are pivotal, again, in the COVID-19 response. And of course, as government and as Ministry of Health, we do stand by those principles and those of the Public Financial Management Act to ensure that these all our measures are accountable and transparent, and we're able to ensure that we're actually stretching, and using our resources rationally. And that becomes very pivotal, again, to the response. And perhaps then the 4th point, which I feel is a pinching point for everyone in the country, is that fine balance between ensuring that there's containment, but also some, form of economic livelihood. And I think for us in Kenya, like I say, again, if a case study was to be done, then it would be amazing what you'd see. I'm aware of close to almost 6 or 7 committees that are working, and these are industry sort of led committees. So we have the hotel industry having, hotel practitioners working together with the Ministry of Health and the line ministry and department to ensure that there's some element of continuity in the protocols that we roll out. And this is again happening in the transport sector. I'm aware aviation have been meeting this whole week to put in place proper protocols. And you can see really the idea of, perhaps realizing that there's really no distinction between public and private, and it's one country, and we all need to be at the table to move the agenda forward when it comes to striking that balance. So I do thank you for your time, and I'm happy to respond to any more questions in the chats and any others that may come up during plenary. Thank you, Dr. Amit.
Thank you, Dr. Mercy. I remember the first days when we started with the first case, and I think it's come a long way. And thank you for being so candid about the engagements on many of the points that you've mentioned. Dr. Lia, over to you. We want to hear your case examples. We've also seen great engagement with the private sector, but we welcome you to address the private sector delegates who've logged in and other members. Thank you. Dr. Lia, over to you.
Thank you so much, Dr. Amit. It's a pleasure really to be in this panel, and great to hear the experiences shared by Dr. Mercy, the great work you're doing in Kenya. I would also just briefly start with the whole coordination of the response in Ethiopia. Well, since the outbreak started in Wuhan in beginning of January, we started the response by activating the Public Health Emergency Operating Center in mid-January, around late January. Mm-hmm. But the overall response is now been laid by our Prime Minister through a national ministerial committee, which has also several subcommittees in different aspects, led by different sector ministers in the area of communication, in the area of logistics, in the whole health response, public health response, and in the as you also may know, we have announced the state of emergency. So there's the state of emergency is also being coordinated by the Deputy Prime Minister in terms of ensuring all the guidances in the state of emergency are being adhered to, as especially the non-pharmaceutical interventions are stated in that guidance. And I mean, the whole response, although at the forefront, the health is there, also in terms of the private engagement or all the state actor engagement, we have the Minister of Health is doing key areas within the ministry itself, but also in all these multi-sectoral coordination platforms, there are different areas of engagement that are going on. Just to highlight few, to start with the multi-sectoral ones that are being led by the different ministerial committees. One of the key areas, of course, as was mentioned in your discussions, is in the area of supplies and also local manufacturing. So in the area of ensuring that we have available all the especially PPE and other needed supplies to prepare the treatment facilities and isolation facilities, and for that preparation and testing as well, there's a high need to get more importers, but also more local manufacturers. So since the beginning, working with the Trade and Industry Ministry, Investment Commission, industrial parks, we've been trying to work to attract more local manufacturers and also shift some of our local manufacturers their products into those that are needed for the COVID response, and to really enable that, create that enabling environment. All the tax was exempted or waived for all COVID-related supplies, for those being imported, but also for those being manufactured locally. Yeah. And encouraging those additional local manufacturers in terms of those the face masks that's being used for the public, but also surgical ones, suits, and other PPE supplies as well. But it's not also limited to that. Through the innovation and technology subcommittees we have, there are some encouraging progresses in terms of maintaining, but also developing machines like ventilators with some private sectors as well, which is still, of course, in its early stage, but really trying to support those activities. But when we also look into other multi-sectoral areas, like was mentioned, communication, risk communication has been one of the key response pillars in this COVID response, which is not handled only by the government, but there has been several platforms or collaborations with different communication firms or artists and other media houses that are both public and private, that are being working together in coordination with the communication secretariat led by the Prime Minister's Secretariat, but also specifically with the health communication, which is led by the Minister of Health and the Ethiopian Public Health Institute. We've also had different collaborations with creating a lot of messaging through both media, but also within community, really creating community mobilization through these engagements. And when we come specifically to the Minister of Health, or health sector, initially, of course, we are all trying to respond to this new epidemic and focusing on what the government can do. So we could say we were a bit delayed to engage the private sector, but we later started to create the platforms of regular communication with the Minister of Health, with the different private sector actors, specifically related to health facilities. And with that, we actually established a private sector desk within the ministry to coordinate this platform. And we started to look at what are the areas we can collaborate on more to enhance the response, but also ensure that the contributions of private sector, which can be immense in these kinds of difficult situations, are really tapped into. So we started, so some of, for example, sample collection is now being done by all private facilities within their facilities for the testing. We have actually need to expand the testing, but one private facility lab is doing the testing together with the other consortium of labs in the country that are testing, but also under discussion to expand those. And in addition, there has been also engagement in training of health workers with the private sector groups in the COVID response, especially in emergency and critical care training. We've had engagement and support by the private sector. And of course, the key is in the main, as we are responding to this COVID epidemic, maintaining the essential non-COVID health services has been a key challenge and priority we are trying to address, both in the government and private sector. So the private sector has been taking a big role in ensuring that services, continuity of services are not interrupted and are maintained. And of course, in terms of case management for COVID, we've had really generous support of the private sector, dedicating 2 facilities, one for health workers who get infected to be treated in those facilities, and also a second one was for a private sector dedicated for those government officials and AU and other diplomats to be, because the main COVID treatment facilities have been only been by the government. But currently we are also under discussion to expand engagement of the private sector in the case management of COVID, to convert some of their facilities to COVID treatment centers, considering the increment of cases and the need from the population as well. So we are discussing on adding more private sector facilities who can now for a time being shift their services to COVID treatment as COVID treatment centers. Otherwise, so far most of our facilities have been, the case management has been being handled by the government facilities, except a few exceptions I mentioned. And we've also had, well, as you mentioned, the private sector is really diverse, and we've also been collaborating with Ethiopian insurance company for the health coverage of the life insurance of those who may be whose lives may be lost through the COVID infection, for health workers specifically, healthcare workers. When we say not just health professionals, but those working in the response, be supportive staff or other professionals. So we had this also collaboration to ensure that we cover those healthcare workers in the event of such happening. And of course, although within the context of the whole response, mobilization is a key pillar that is being laid under the subcommittees under the ministerial committee, the National Ministerial Committee, which has really a big engagement of the private sector in mobilizing, as you mentioned, with the corporate social responsibility, giving not just financial support, but also technical and community mobilization work has been done. But it has been really a huge engagement of private sector in terms of resource mobilization. And of course, the engagement of other private sectors outside of the country to support this through resource mobilization has also been going on, not only limited to Ethiopia. As you remember, we've had our Prime Minister's initiative with Jack Ma Foundation to support the access to testing and PPE supplies through this donation to all African countries, where we engaged, where we have been working with Ethiopian Airlines and of course Africa CDC and WHO also in the distribution of this supply. So this was also another example of this engagement. There has been really several activities going on, but I do believe that we still need to strengthen and work more on those. And we have been preparing a joint plan between the private sector and the Ministry of Health on those specific areas on how to expand those collaboration activities. And hopefully we'll start the implementation of this, endorse it and start the implementation in terms of the expansion of the engagement areas. But as government also with this response, overall impact on the economy, there has been also directives that have been coming out to support the private sector, to ensure that the private sector keeps thriving in terms of waiving some tax and other issues have been also being looked at at the government level. And I think that, of course, there are different challenges in terms of how we want to move forward. And maybe some of them are like the bureaucratic processes, I mean, the rules and procedures that we have in place that sometimes impede us into how fast we want to respond in these kinds of collaborations, as well as the resource limitations are also some of the challenges, because, for example, in terms of the services that the private sector is delivering, we should be supporting enough, like with PPE supplies, for example, those for the private sector that are delivering just even the non-COVID services, because those are needed at this time. But because of the resource limitations, that may not have been enough. So this is also one of the concerns from the private facilities, which we are trying to address through the large procurements that we are currently doing, both international procurement and local procurement, to meet the demands of the big nation that we have of more than 100 million, with a large number of facilities with a big need for PPE right now, not just for the COVID treatment centers, but those who are also doing non-COVID treatment, because all of the cases are coming from are being detected in the different facilities. So, but with I think commitment on all ends, I think this is really achievable. I don't think this is unrealistic, and actually this is a really good opportunity. I believe that this challenge that we have with the COVID pandemic has also brought a lot of opportunities on how we can really bring synergy by strong collaborations, authentic collaborations with larger impact. And we are also seeing these kinds of collaborations really bringing impacts. And even in the one thing I have not mentioned probably is within the response that the ministry is leading, the health task force and emergency operating center, we work with different groups as advisory councils, which are different professional associations. They are consortium of different professional associations, which includes both government, private sector. And this support of advisory groups has really helped in how we respond to this COVID pandemic, which has been one of the critical pillars for our response. So there's a big opportunity to be tapped into, and we need to, of course, really work more on those ends. But thank you very much.
Thank you, Dr. Lia. That was so comprehensive. And when you presented, there were so many similarities between you and Dr. Mercy on testing, treating, and also training. But you also brought about insurance company, which was really good on protecting some kind of life cover, as well as the private sector support, such as tax incentives. But twice the size, Dr. Mercy, Lia is managing twice the size. When you talked about vastness and diversity, Dr. Lia has responsibility of over 100 million people. And you're fortunate that both Dr. Mercy and Dr. Lia, you have an organized healthcare federation in both your countries. And I'm sure you're working very closely with them, who are also very passionate. It gives us a nice segue to move into Her Excellency Amira el Fadil from Africa Union. You've heard the two champion ladies from Kenya and from Ethiopia leading the challenge and driving in. Where do you see the private sector play a greater role, and what can Africa Union do for these opportunities? And we are really delighted you could spend some time with us and give us an African framework. Honorable Amira, over to you.
Thank you very much, Dr. Thakker, and it's always a pleasure to be with you and your team to exchange on what the African Union can do with the private sector, with our ministers of health. And I thank Her Excellency Minister Lia for sharing the experience of Ethiopia. I also thank Dr. Mercy for sharing the experience of Kenya, and Kenya was the last country for me to visit before the lockdown, when we had our press conference with His Excellency President Uhuru Kenyatta, when he was announced as a new chair of ALMA. So it's always good to see you, Dr. Mercy, and Kenya is one of the active countries in all our coordination committees, whether the ministerial committee or the technical committee, so as also Ethiopia. When it comes to public-private partnership, Dr. Thakker, is not new at the African Union. Mm-hmm. It was way before COVID-19, and if you can recall, our meeting on the 11th of February 2019, the very successful meeting on the African leaders on health, investment, the initiative by the president of Rwanda, Paul Kagame, and you were part of that meeting, and many heads of states participated. The call for action, which is a main outcome of this meeting, is very much recognizing the public-private partnership and calling also for more engagement with the private sector within Africa, and also the private sector outside Africa. When this COVID-19 was declared by WHO as a public health emergency of international concern at the end of January, the first thing we did as an African Union is we convened a meeting for the Ministers of Health. It's an emergency meeting on the 22nd of February. It was a face-to-face meeting here in Addis Ababa. The attendance was very high from our Ministers of Health. The main outcome of this meeting is the endorsement of the joint continental strategy on COVID-19. And this is our main framework for fighting COVID-19 in Africa. On the 11th of March, when also WHO declared coronavirus as a pandemic, this declaration was followed immediately by the meeting of the Bureau of Heads of States and Government, chaired by President Ramaphosa as the chair of the African Union. So we have a vision, a very clear vision on what we are supposed to do. The continental strategy was adopted, then it was endorsed by this Bureau of the Assembly of the Heads of States and Government. So what I wanted to say that there is a political leadership in Africa from the beginning. There is an agreement that we are acting on this fight together as an African member states, and they agreed that the leadership should be done by Africa CDC. Yeah. The engagement of the private sector, Dr. Thakker, was there from the beginning. The second meeting for the Bureau of Heads and States and Government, in the second meeting, the President Ramaphosa invited business leaders from Africa to the meeting. And when he invited these business leaders, he also appointed 6 special envoys. And the 6 special envoys, 4 of them are former ministers of finance, very well-known Africans who have experience in working in their countries and also have experience in working in the international financial institutions. These 6 special envoys, they have been tasked with 2 things. First, they have been asked to engage with the international financial institutions like IMF and like World Bank, the G20, and to try to work with them on the issues to do with debt relief, having a moratorium on paying of interest, introducing economic stimulus packages to Africa, looking into the issues of the sanctions that some African countries are sanctioned unilaterally. So these envoys, these are their main task, and they are doing it very well, Thakker. The second task, they have been tasked to do resource mobilization. And the heads of states and government also from the beginning, they agreed on establishing a fund, anti-COVID-19 response fund. In this fund, we have allocated 3 seats for the private sector. So the private sector is represented. We have 10 members to the board of trustees. 3 of them are coming from the private sector. I can mention the chair of the Afro-Exim Bank, the president of the Afro-Exim Bank, President Orama, and he's been elected as a chair of the fund. We have also a representative to Dangote, also as part of this fund. And they are also, by engaging them, we are engaging also the private sector of Africa. If I take an example of the engagement of the private sector outside Africa, we are, as we mentioned also by Dr. Lia a few minutes ago, that Jack Ma Foundation, they supported Africa, and the initiative was from the Prime Minister of Ethiopia, Excellency Abiy Ahmed. We really appreciate his role, because the first Jack Ma Foundation donation, the second Jack Ma Foundation donation, it is an initiative of the government of Ethiopia, and the consignments were delivered to all member states of Africa. This gave a very strong support from a private sector outside Africa. The third donation was also provided from Jack Ma Foundation, but directly to the Africa CDC and African Union. And of course, as mentioned also by Dr. Lia, WHO and WFP was partners. The carrier was Ethiopian Airlines, and they did a very good job in delivering in a very short time all these medical supplies to the member states. Another example of the engagement of the private sector is our engagement with EcoBank, Africa's Continental Bank, that offered services in hosting the AU COVID-19 fund. I just mentioned that we have established the fund. The fund, the first day of the establishment of the fund, the heads of states and government, they made their own pledges. They made pledges of $61.5 million. Part of it to the fund, and part of it to go directly to Africa CDC. But another example I want to share with you on the engagement of the private sector of Africa, the 6 envoys were tasked on the financial issues by President Ramaphosa. But also there is part of the private sector and the businessmen of Africa, they have been tasked to deal with the issue of the supplies, because we know that our biggest gap in dealing with this COVID-19 is in the medical supplies, that very few medical supplies are manufactured locally in Africa. We need to buy from outside Africa. So Strife Masewa was appointed by President Ramaphosa also as chair of the African Union to lead a forum on providing Africa with medical supplies. What Masewa did with his team and some of the private sector personnel in Africa, they created an electronic platform for medical supplies. And this platform, it answers all the questions. It answered the question of the availability of the medical supplies needed by Africans or African countries by identifying the manufacturers, also negotiating the prices with the manufacturers. The issue of the cost itself, if member states they want to buy but they don't have enough budgets within their countries, also Afro-Exim Bank came in with solution that Afro-Exim Bank can refinance this purchase, and later member states or a bilateral agreement can pay back the cost to the Afro-Exim Bank. So we put solutions in this platform. They already negotiated with manufacturers. They negotiated the quantities needed in every country, because already the projections of the needs are made by Africa CDC and the member states. So we know what member states needs, but in terms of testing kits, ventilators, respirators, BBEs. So there is projections. Upon these projections, this platform is created. They negotiated everything. Right now, any member state they want to buy, they can go online for this application. They can order their purchase from the manufacturers. Even airlines also were identified, the airlines that they can do the shipments, including Ethiopian Airlines. And this platform, it was first approved by a joint ministerial meeting between the Ministers of Health and Ministers of Finance, and later it was endorsed by the Bureau of the Heads of States and Government. So I think these roles that are played right now by the African private sector is a very big role. It proves that public-private partnership can be very effective in the development of Africa as a continent. Public-private partnership is very important in delivering better services in the continent, in fighting epidemics and outbreaks in the continent. So these are just a few examples. I'm sharing it with you. We will continue as a commission for this partnership. And before summing up, Thakker, I would like also to mention that we have also launched an initiative for more testing and tracing in Africa called PACT. PACT is a partnership for accelerating testing in Africa. And also PACT, we are doing it with partners from within Africa and outside Africa. It's a chair of the Commission initiative, His Excellency Musa Faki, launched by him, rolled out by me and by Dr. John. Yesterday, I was informed by Dr. John that the testing now in Africa is more than 3 million. Our target is 10 million, but we are expecting even more from our member states. We are also using this partnership in sending more responders to member states. We are also planning to train health workers. Our target is 100,000 individuals to be trained from the health workers, and this is part also of our initiative of the 2 million health workers. These are just a few remarks I wanted to share in this meeting, Dr. Thakker, but I believe very much in this partnership between the governments and the private sector, starting from the national level, going to the regional level, going to the continental level, and to the international and global level. It's very effective, it's very much important. I noticed that Dr. Lia, she spoke about a joint plan of action between the private sector and the government, which is very good. It's a model to be followed. We need to have a full plan of action. What we did so far is very much appreciated with our private sector in Africa, but also if we manage to have a full action plan, it will be better. So everybody will deliver upon agreed action plan. Thank you very much, Dr. Thakker, again for organizing this very important webinar. Definitely, we will continue to engage you and the Africa Health Federation and also all the private sector in the continent. We call upon them to come and join on all the levels, because if we can put our efforts as governments to their efforts, we will manage to prevent having more transmissions of COVID-19 in our countries. We will be able to mitigate the social and economic shocks from our continent, Africa. Thank you very much, Thakker.
Thank you, Honorable Amira, and congratulations on such quick action from Africa Union. With the leadership that you have and the leadership of your team, you've been able to get political support very early on our continent compared to many other countries around the world. I know that the 22nd February meeting, the 11th March meeting have all borne fruit. You know, COVID-19 is young in Africa, and we are just at the beginning. And I hope that through this partnership, we can keep up with the efforts and resource mobilization so we can save more lives. You've rightly put it that this should be a series and not an event. And I think what will happen is it'll make us even stronger after COVID. So when we are post-COVID, I think it will leapfrog Africa another 5 to 6 years ahead. But right now, the priority is to save lives. We need to save lives on our continent, and the political support that you have brought together, I will definitely take you on for a continued series and more countries. We have 2 countries here that are represented. there are many more countries who are have more to share, and other countries who are struggling because they have even very little resources or fewer private sector. So I think that the three presentations you've seen from the comments have been very well appreciated by everyone. They have really been taken in very positively. I know we have overshot the time, but I am going to ask Elena and the team behind to give us one or two questions that may be useful for our panelists to answer before I also ask them to give the closing remarks. So Elena, Farah, and the team, do you have the questions available from the crowd? I know that Dr. Lia and Dr. Mercy have also been answering directly with the team. Can you let me know?
I have one question here for Dr. Mercy. How long will it take you? How long will it take you to materialize the PPP, as it would be a great lesson for us in Ethiopia, because there has been taking over 4 years to do this?
Go ahead, Dr. Mercy. Would you be able to answer that?
Thank you. Thank you for that question. I think perhaps the best example would be that COVID-19 created the silver lining that was needed to just simply do it. In Kenya, we have struggled, in terms of trying to put in place structures that promote PPPs. We actually have a thriving PPP unit, and we also have, a lot of strategies in place and a lot of, meetings and documentations, all with the aim of cascading and enhancing PPPs in Kenya. However, when COVID-19 came into being, not to sound very simple, but we just simply did it. We just put together the teams and we moved forward, and it was a lot of learning, as that's happening, a lot of learning, a lot of, going back and forth. And perhaps the biggest lesson would be that it's become very interesting. Our COVID-19 response has been pegged on what is known as the Public Health Act in Kenya. And the Public Health Act is actually perhaps an act that dates all the way to the independence of this country. And what it did for us is provide us that space and ability to be able to put in place some of these initiatives. And so one of the biggest lessons that we're drawing from this is that when it comes to a public health, emergency or a threat to public health security, then you sort of need to have that legal framework that allows for such nimbleness. And in that legal framework, then can definitely be the role of private sector and how you can actually, have those collaborations moving forward. And I must say, even as much as we've been able to put together the COVID fund, and again, that was really fast-tracked in collaboration with the Ministry of Finance here, and put together with regulations, and it was moving forward. What we've noticed is that in the next response, as we try and put together our laws for, public health security, there may be need, for a section that actually mandates, putting together public and private resources towards supply chain needs, towards, even providing some form of contingency for private facilities. And so it's an evolving relationship. It's an evolving, intervention. However, really, we just did it. We just put together a team and we moved because we needed to move, because we were in crisis mode.
Correct. Thank you. Thank you, Dr. Mercy. I'll go to Honorable Amira. There is a question. There are some countries in Africa that are more vulnerable and more in need than others. When you receive $100 into the kitty, will you take into account some more priority for countries that are weaker and member states that are weaker? How will you make sure there is equitable distribution so that we have the whole continent involved?
Thank you, Dr. Thakker. We have a technical task force co-chaired by Africa CDC and member states, and all the 55 member states are represented in this task force, from high officials from the Ministry of Health, permanent secretaries, experts, epidemiologists. But this task force is the task force that leading on the technical level. Mm-hmm. We know the epidemiological situation in our member states. And we know that there is variations in the capacity of the countries to respond. So we developed criteria on how to support member states who are in most need of support. So we have our criteria. I can give you the example of this criteria: the number of the population,
Okay.
The number of the infections in the country,
Yeah.
The capability of the health system in the country to respond, the human resource also dimension, if the country is capable or not. There is member states who requested from us to support them by sending technicals to their countries. And that's why we have started the deployment of rapid responders. We took our volunteers from DRC, from Kinshasa, to 5 member states in Western Africa as a rapid response. There is a request from 11 member states. We are responding to this request, but we are very much aware of the situation in the continent. And also there is a data sharing between us and our member states. Our Emergency Operations Center is sharing the information. Through the task force, there is a sharing of information. And we are encouraging member states even to share with us more data, and if they can share with us a disaggregated data also on this COVID-19. So these platforms we created, like the task force, are very effective, and we are following up on a daily basis. Dr. John Kingston and his team, Dr. Ahmad, Dr. Benjamin, all of them, they are in continuous communications with member states, receiving calls, replying to emails. There is some things we do it upon request from member states. There is others we can do it from our side. We can initiate from our side. But I can assure you that there is criteria in place on who are the most needy countries and how to support them. Thank you.
Balance. Thank you so much for the balance. Dr. Lia, one more question before we go to parting shots, and maybe other questions we will also respond to the clients directly. Dr. Lia, what is the concern about some of the private sector who might be coming to trade or to sell the products, and you might find some people hiking prices, and later on you find with limited government resources, you might have spent in procuring supplies or purchasing PPE. Do you think that is a concern that you would like to express to the private sector that is logged in? We know that all is not well. There may be some private sector players that are not following the protocol and are taking advantage of the pandemic for economic reasons. Have you faced such a situation, and what is your advice to the private sector?
Thank you, Dr. Amit. Yes, those challenges are there in terms of not just specific the medical supplies or equipment, but in general as well. But we have also seen, especially in the area of PPE, one of the big challenges we've had was really how the cost has really gone up very high. Some of it may be related to the obvious global issue with a global shortage and concerns, I mean, the export being limited and so on in some countries due to the pandemic. But some of it needs to be really looked at, because we are trying to cover actually large country with large procurement. So it could be much easier for all of us if we really maintain those costs at lower level, so that we can expand access, but as well as we can be able to use those limited resources that we have in terms of achieving both engagement of the private sector, but also ensuring the availability. So we do have noticed that concern, and especially as an example, for example, if you say look at surgical masks, the price has really gone very high in terms of I don't exactly remember how many folds it has gone up, but it was really dramatic. So these are really concerns that we collectively hope to address to ensure that we can maintain both balances at the same time.
Thank you. We stand together with you in the genuine fight against graft, maybe any kind of waste that you might see. I'm shouting out to the private sector to be very mindful of every fund that the Ministry of Health does spend on this. As I said, we are in the early days of COVID-19. We really don't want to see any kind of financial audits that are misappropriated 3 months later, 1 year later, because we have a lot to do together in the health system. So we stand together, we'll work with you, but I think your message is very clear. And we wish you all the best in your endeavors, because you are in this difficult stage, and teamwork and partnership is the success formula on how we will go through this surge. Let me begin by asking Dr. Mercy Mwangangi and then Dr. Lia to give their closing remarks, and then we'll end up with Honorable Amira giving her final shot. So Dr. Mercy Mwangangi, over to you for your final closing remarks.
Thank you, Dr. Amit. For me, I think the closing remark would really be, a reflection of our meeting today. COVID-19 has brought us together. I think perhaps this is the first time we've had so many engagements online, and been able to find new ways of doing things, and also perhaps even finally appreciating the role of partnerships. And so as we move this forward, we have to find a way how we ensure there's continuity of these partnerships, and that is a cementing of these partnerships. And I'm happy that Kenya has a very active health federation, and so does Ethiopia. It would be useful perhaps then to, through these platforms, talk about the evolving story in health, talk about UHC, talk about all other collaborations that we can put together in terms of moving our health sectors forward, and of course, ensuring that there's a resurgence and a resilience in our economies. So I do thank you all for your time, and I'm happy to have been here today. Asante.
Thank you so much. Dr. Lia, over to you.
Thank you, Dr. Amit. It's really been a great pleasure to be part of this panel. And as Dr. Mercy said, as much as challenges are there with this huge pandemic that's affecting all of our countries, I really also always want to see it as what is the opportunity for going forward, in terms of having really strong collaborations across the world, across the continent, with the countries. It has really shown us that we can do a lot more when we are together, and bringing what we have together to solve the issues on the ground. And everyone has a stake, and everyone has also a role to play in terms of solving the issues, and especially with the focus of today's platform. One of the key areas we have seen in this response is the big capacity that the private sector, the non-state actors, with government, how they can really move things forward if we are engaged meaningfully and intentionally at all areas. So I do hope that we'll see more strong platforms and collaborations also post-COVID that can really move our health system and all our economies forward. So thank you so much for bringing us together in this platform today.
Thank you. Thank you, Dr. Lia. I'll now turn it over to Honorable Her Excellency Amira for closing remarks.
Thank you, Dr. Thakker. And in every crisis, there is opportunities, and we should look for these opportunities. And one of the opportunities we are taking amid this crisis is to strengthen our health systems in Africa, and to make sure that we will be working on the 3 pillars, on the area of diagnostics, and the area of therapeutics and treatments, and also in the area of vaccines. So we need to strengthen Africa in these 3 areas. We need the private sector of the continent. We need the private sector outside Africa to engage with us more, so we will make sure that when we go out of this COVID-19, there is a life of this after this COVID-19. We want, when we go out of this COVID-19, to have better equipped and strengthen health systems in the continent. And for me, I believe it is doable with the commitment I see, starting from the political commitment, the technical commitments I see it in the continent. I think it is doable. Africa after COVID-19 will be even more stronger than before COVID-19. To do so, we need everybody on board. What we are initiating as an African Union is we are working on a comprehensive document on the socio-economic impact of COVID-19. We are sharing this document with our partners. It's a document being prepared by the 8 departments of the African Union, plus NIBAD and other technical bodies of the African Union Commission, and we are sharing it with our partner. We think this will be the main document for the African Union to be implemented in 2021, because we are projecting the impacts and the effect of COVID-19, and also we are putting proposals on how to mitigate these negative impacts of COVID-19. We still need to continue on balancing between the saving of life and the livelihoods. And we know that we have a very difficult economic strains in Africa. We need also to deal with it. That's why we are developing this comprehensive document. But I will end by again re-emphasizing the call that our doors are open as an African Union Commission. I call upon all the private sector to come and to be engaged from the national level to the continental level. Thank you very much again, Thakker, for organizing this very important webinar. Thank you.
Thank you, our esteemed panelists. You've been absolutely clear and absolutely spot on. Thank you to the team members who supported. Thank you to the leaders of the private sector who logged on this morning. You heard from our panelists. It's all aboard. It's only when we are all aboard we have hope. It's only through the hope of one continent, one team, that we'll be able to stand together post-COVID-21. We have shared the optimism of partnership. We have shared the optimism of hope, and we have shared the optimism of post-COVID. Let's stand together for Africa, and we will overcome for sure. Thank you all for attending, and bye for now. Have a great day.